So now that you have a very cursory overview of how NAD works and the importance of the IV therapy and how it can help many, many different types of conditions, I want to stress, I hate that word, I want to emphasize the importance of doing other adjunctive therapies as well as the IV NAD, because to get the full benefits of the NAD, you've got to help the body to excrete these residues coming out of cells. So let's get started with that, and I'll explain some of those things we do here in a clinic. So we're back to the same illustration as before, a reminder about the different fluid compartments of the body, and the reminder about the toxins leaving the cells and getting to the interstitial lymph fluid. So this is, again, a very cursory illustration. The lymphatic fluid, again, bathes every single cell of the body. There are main channels where lymph, sort of these tributaries, flow towards main channels, which is this is trying to illustrate those main channels. And the small green circles are lymph nodes, which are watching for what's passing through the lymph, looking for bacteria or viruses or whatever, and then they'll begin to produce more antibodies or white cells as a response. But one thing to note here, this lymph vessels are not at all like the heart. The heart pumps blood out into the arteries, and the smaller arteries, arterioles, the capillaries, and then the blood flows back through the venous system to the heart. And then, of course, there's another part that goes up to the lungs for oxygenation of the red blood cells. But the lymphatic system only has sort of like one direction that goes from the feet up to the chest and from the head down through the neck to the chest. And there are two ducts or channels which the lymphatic fluid drains through those channels and empties into the bloodstream, back into the circulation. This sort of illustrates, again, the blood circulation, and we have primarily the liver. The blood passes through the liver, and that's one important organ for blood cleansing, for breaking down waste so it can be filtered through the liver, also making some of the toxins more water soluble so that they can be processed by the kidneys. So here's an illustration of the liver. You can see this, the green vessel is the waste, what the liver has filtered, and waste is traveling down that duct, and part of that waste will be processed by the gallbladder, where, again, another process where the more fat-soluble toxins are becoming more water-soluble. And gallbladder responds to a hormone produced in the intestines, which causes a contraction of the gallbladder, and the gallbladder will release bile that travels down that same duct. So all the bile and all these residues from the liver are being dumped or emptied into the first part of the small intestine. And as you can see here, that blue part of the illustration is what food, whatever is coming down from the stomach, empties into that blue section. It travels for quite a ways until it gets to the second part, the green part of the small intestine, the ileum, and then from there goes through, 20 feet approximately of the small intestine. The colon is 5 feet, so that's a long distance, 25 feet approximately, for waste residues that are being excreted from cells into lymph. Lymph drains them back up into the bloodstream. The bloodstream travels through the kidneys and liver. The liver is filtering some of them. They then go into the small and have to travel around 25 feet through the intestinal tract. So the environment of the gut ecology, the environment of the intestines, is really important for aiding the body in its important pathway of detoxification. And if people are having issues with slow transit, constipation, slow transit times, some of these residues can actually be absorbed back into the body. We did that already. So ascending, transverse, descend, colon. So this is an illustration for a fat cell, which is a little different than other cells of the body. And this illustration, as far as the mitochondria, is pretty accurate. There's maybe 1 or 2 mitochondria compared with hundreds and sometimes thousands of mitochondria in other tissues, other cells. Fat cells play a really important part, or a part of our health, and that is that nobody's body is 100% effective with detoxification. So when these residues are circulating around through the lymph and through the blood, and the body is sensing these residues, miraculous how it does this, it sets off a little bit of an alarm. There's toxins, there's chemicals in the body, let's get them out. Okay, kidneys, liver, whatever, work your best, but I need to protect my brain and neurological system and my reproductive organs. Somehow these residues are piggybacked onto primarily triglycerides, a form of fat or lipid, and carried into the fat cells. So now we have both fat, which is a potential energy, a reserve of energy in case the body needs to produce glucose or free fatty acids, which we'll get into in another video. That's its source of potential energy in case there's nothing to eat or consume. But these residues also cause these mitochondria to begin to decline in their function. And this is one really important reason why it's so difficult for people that are having weight issues to lose weight. If the mitochondria are not functioning optimally, the fat cannot be excreted as efficiently. So this is another thing. So if you're having issues with weight, this is the increasing mitochondrial function is going to help a great deal with that. So back to the same illustration as before, the chemicals coming in, being absorbed and causing mitochondrial dysfunction. These go into fat cells as well, accumulated or compartmentalized in fat cells. So here's really an important point. A lot of the fat cells are just under the skin, called the subdermal fat layer. And if we can get these residues in these fat cells out through the skin, that would be a much easier transport rather than having to deal with toxins coming out of fat and going through the body and going through lymph and blood and kidneys, etc., liver. Why not just simply help them to be excreted through the skin? It's a really direct and short route to get these residues out. So just a little review. So toxins drain from the cell into the lymph. Lymph drains into the bloodstream. Toxins in the blood are filtered by both the liver and kidneys. Toxins in the liver travel the gallbladder into the intestines, and they travel the entire length of the intestinal tract. And then we have residues also stored in fat cells. So let's get into some purification. How can we improve the fluidity of lymph so it flows more easily instead of like lymph is, for a lot of people, the lymph is so thick and so toxic that it is like a swamp. We've got to drain the swamp. So this is a great old naturopathic therapy developed by Dr. Carroll, who'd spent a good deal of time in Europe learning about the old nature cure systems that were there, learned a lot about the use of hot and cold waters known as hydrotherapy. So I went to study with one of his pupils, Dr. Harold Dick, and during my preceptorship 30 years ago. And this is all he did two things. He did what's called, he called the constitutional hydrotherapy. We call it lymphatic hydrotherapy. He did that. He had 5 tables. People would come from him from many different parts of the United States. They would stay for usually 2 weeks, and they would do this hydrotherapy twice a day for usually 2 weeks, and sometimes longer for people who are really toxic. But he also did a type of food allergy or food sort of sensitivity testing, and he'd take people off of food at the same time. So how this works is that the person is lying on their back on a table, and we put a hot compress over the chest. So the top part of the compress goes above, remember those ducts where the lymph drains? It covers as high up as the bones or the bottom of the neck, and covers all the way down to the pubic bone. So all the chest is covered with this hot pack for approximately 5 minutes. And then that is switched to a cold, these are water compresses, switched to a cold compress for 10 minutes. And I'll just do the next slide, and then I'll explain a couple of things. We also use a sine wave machine. This is 2 lines come out from it, and there's 2 pads, 2 sponge pads, which are placed during the cold part on the back, kind of a little bit below, but a little bit, the right underneath, but a little bit below where these ducts are, where the lymph fluid drains back into the bloodstream. So what's happening with this heat, I'm going to go back one. What's happening with the heat is that there are, and I should have put this in, there are what are called dermatomes, which are sections on the skin which neurologically relate to organs below the skin. So if you put hot over the liver, it's going to cause the skin to get warm, but it also causes the liver to sort of expand and brings a lot more blood into the liver. So when you have this hot pack on the whole abdominal area, you're talking about blood coming to the liver, the gallbladder, the stomach, the spleen, the pancreas. All the abdominal organs are opening up, and a lot more blood, a lot more oxygen is being delivered. So this is what we want to do. We want to bring more fluid to these organs because they're detoxifying, they're getting rid of their residues. Then the cold causes the opposite. The cold pushes blood away, so it's like kind of like squeezing these organs to pump fluid out of them. But what happens with the cold is that when you put cold on the skin, it pushes blood away. But the body's compensation, the secondary effect, first effect is of the cold is to push blood away. The secondary response is the body wants to warm up that cold compress. So it pushes blood away, and then the body brings blood back. It's an amazing treatment. I mean, this is all Dr. Harold Dick did, was just helping people recover their health with using hot and cold packs. Remarkable. Again, the sine wave is used for helping with helping lymphatic pump. So once this is done, hot 5 minutes, cold 10 minutes, then the person turns over, and the same thing is done on their back. And all the nerves running down the spine are also sending signals into the interior of the abdomen and also the lungs, etc. So this helps liver and gallbladder function, helps digestion, digestive system, the pancreas, the spleen. Then we have, an important part of detoxification is getting these residues out of that 25-foot tube before they're reabsorbed again. And part of this is the supplements we'll talk about, and changing the gut ecology, etc. So we use a closed system. Left side is the unit that we use. It's got, I think, 4 filters for purification of the water that is used to for the colon hydrotherapy. It involves all sterile. Every single client, we open a new pack for the speculum for the tubing for this. It's water temperature is usually body temperature. It's a very, very gentle and safe therapy for helping to clean out the colon part of this. So the speculum is inserted into the anus. The water travels very, very slowly up the colon on the right-hand side, the descending colon. As soon as a person feels they need to evacuate, the therapist opens the valve and the water travels out and through a glass tube, which you illuminate it so you can see what's coming out. Sometimes you can help people understand that there's a lot of undigested food here. You're lacking enzymes, etc. And ways of using colon hydrotherapy besides the therapeutic benefits to really kind of help understand something about their digestive system and parasites, etc. So back to the skin, we want these toxins to preferably leave through the skin rather than being released into the body. So saunas are really the premier. What was it? L. Ron Hubbard, he put people in saunas for 4, 5, 6, 7 hours, taking niacin ahead of time to cause some flushing. Niacin being a part of the NAD, nicotinamide, that's a B3, so niacin is really important. I think somehow he had a great intuition about things, and providing people with niacin was also helping to improve their NAD production. So this is our sauna that we have. We try to have it private. Sometimes we have quite a few people who've got to share the sauna on the left-hand side, and then right across from that green mat is the shower, which we've installed one of those large buckets, so people get a really good sweat going for after 10, 15, maybe 20 minutes. They step out, go into the shower, pull the bucket down, it automatically fills with cold water. They get a nice waterfall, brisk sort of a sensation, which has its own benefits, and then they get back into the sauna. So they do cycles of hot, cold, hot, cold, hot, cold. Usually they're doing this for an hour. Another type of sauna we have is the capsule, where they sit inside of, and we put ozone into the sauna. So the heat again is helping to release toxins from the subdermal fat layer. The ozone, if the skin is wet, will penetrate through the skin and get into the capillaries. This is beneficial for people that we see under a dark field microscope if they have any kind of issues with pathogens and mold, etc. So my experience is that doing NAD IVs all by themselves, there's certainly benefits, but I feel that it's not enough. I feel that if those practitioners doing IV NAD alone could see the results that we're getting, because we're helping the body, assisting the body to also excrete these residues, I think they'd probably be a little bit more online with what we're doing. So it is the foundation. It is the most important therapy that anyone can do to recover from really any condition. We've focused primarily initially on people in recovery that have a history of drug use or abuse, and they've finally gotten themselves off, but they just feel like their life is not at all what it was before. This is where a lot of the IV NAD therapy has been done in the past, but now we're realizing that everyone is intoxicated with chemicals, residues, environmental infections, etc., endotoxins, biotoxins. So really IV NAD can be used for almost any chronic condition. But as we explained, it has to be coupled with purification. And also other underlying issues, which we'll get into a little bit more, but there's reasons why people are prescribed pharmaceuticals by their doctor who likely or often has not investigated other hormonal and biochemical imbalances, thyroid hormones, adrenal fatigue, blood sugar dysregulation, lack of cortisol, all these things, lack of cholesterol, all these things which are underlying causes were not thoroughly investigated by their clinician. And this is also another part of what must be done in conjunction with the NAD IV and also the purification. Nutritional deficiency is huge, and this is not just because people are not eating well, which is true for most people, but also because they are not fully digesting their food, and therefore not able to get the nutrients, but also there's some issues with assimilation of of these nutrients. And there's also silent chronic infections. I spoke about that before a bit. So bacteria, including spirochetes, viral and mold issues for people. And I talked about that already. And being sure that people that are coming to our clinic, we usually do an interview, unless they're local, well, even local, we have to make sure that they're not being exposed to environmental toxins in their home and workplace. I mean, it wouldn't make any sense to be treating them with this NAD and purification and all nutrition, etc. And they're feeling well, but they've got this exposure, and they're just going to start getting intoxicated once again. So that's the presentation. We'll get on to, I think the next one is going to be on the importance of certain supplements. So thank you.